Hi everyone, my name is Kreena Patel and today as part of the Endo Expert column this month we're going to be talking about four-handed dentistry. So today I'm going to be doing a few demos with my nurse Anna and I'm going to be showing you how to do some simple things like putting paper points into tweezers and passing irrigation syringes and things like that for you. Four-handed dentistry is really good because four hands are much easier than two hands. So if you have someone helping you, it really makes your work much nicer to do in the first place, but also much faster and more efficient. For endodontics, it's really important as well because quite often we're working in a small field and we're using magnification, so a microscope or loupes. So if you can have someone putting things in your hand, it's much easier than having to look up away from the field that you're working on and picking things up from your tray. So here comes a few demos and I hope you enjoy this month's column. So we're going to start with paper points. If we can imagine there's a patient here and I'm looking through the microscope, so here we go. Now when I'm looking through this, what I want to do is look right through here and I don't want to be picking things up off my tray and things like that, so it's nice if I can have everything handed to me. So if I look through here, if I want paper points, we normally have two tweezers on the go, so we have one and two. They're locking tweezers so that they can lock the paper points in. And Anna will have loaded it for me, so as I look through here, it's going to go straight into my hand. Now, if it's an upper tooth, it's going to be handed to me in this way, and if it's a lower tooth, it's going to be handed to me in this way. So let's pretend that we're doing a lower tooth first. And then I immediately use it. I hand it back, and it goes straight into my hand. So really, I'm doing very little work, Anna's doing the most work, because she's having to load and unload. So that's how it's handed. And then the other reason that we often want to do four-handed dentistry is with irrigation. So if we're using an irrigation syringe, quite often I'm then activating the irrigant at the same time. So we're going to show you the same thing but with an irrigation syringe. So again, it gets handed to me. If it's an upper tooth, it's going to be handed to me like this. And if it's a lower tooth, it's going to be handed to me like this. So I then hand it back. My hand is then open and I can use my activation. I then hand it back, and again, back in for the irrigation, back in for the activation, and then back in for the irrigation. And I'm not having to look up at all. Hope you enjoyed that demo, and good luck when you try it for yourselves.
Just get in the way. Finding that I'm free. My words just get